So today I'm just going to give a little tutorial on how to use Fuji IX. Fuji IX is another temporary material you can use instead of using IRM. I find it works a lot better as far as long-term use. We actually use this as a permanent filling in dentistry. It seals the tooth a lot better, and then also because it releases fluoride, if there's any decay in the missing filling area, putting this on there will help arrest it and it won't spread as much underneath there until the patient can get a final or definitive filling in that tooth. So this is Fuji IX. It's a powder liquid mix. You can order it from Medlog. It's available there. So this is the box that it comes in. Inside the box, you're going to get a couple things. So it's going to come with a mixing pad. You don't need that. You can just mix it on paper. A measuring scoop. You're going to have the powder. On the powder, you're also going to have the ratio. So there's 1 scoop to 1 drop of liquid. That's your ratio. So that's on there. So don't worry about remembering how to do that. That's right on the bottle of powder. And then you're going to have the liquid. And the liquid's kind of like a gel-like material. So that's what comes into the box. Some extra things that'll be good to have, of course, a patient, and then a spatula for mixing. If you don't have a spatula for mixing, any kind of stick will work if you have a tongue depressor or something like that. A dental carver. Any dental carver will work. This stuff gets pretty soft before it sets completely hard, so you can actually trim that back a little bit. A couple Q-tips or cotton tip applicators, and those you're going to have to wet those a little bit. And then if you can, this is not as crucial, but this is good to have, is some kind of articulating paper. Brand is not specific. It comes in lots of different kinds. Medlog can order that for you as well too. So that's just some carbon paper like this so you can mark where the patient's biting so you don't leave that too high, because unlike IRM, this material is going to be rock hard once it sets, and it's going to be very uncomfortable for the patient if you don't get it adjusted to their bite properly. So, so we have your patient here. We've got a missing filling here on this lower molar, and so we're just going to fill that up with some Fuji. So the first thing we're going to do is make sure we clean any debris out of there, rinse it out, get any food or anything that's stuck in there out of there, and get it as dry as possible. So, some canned air or just some gauze or something there to dry that up. So next we're going to have our powder and our liquid. So you're going to shake the powder up a little bit to kind of loosen that up. When you take the lid off here, there's a little scraper that'll help you measure. So I'm going to get 2 scoops in here just so I have enough to fill everything. So you just kind of use that little scraper there to accurately measure that. All right, and then next the liquid. Now you may need to add more than 2 drops. So I did 2 drops or 2 powders. Here's 2 liquids here, and I may add a little bit more to get a different consistency if I need to. So again, the mixing pad's nice to have, but it's not mandatory. You can kind of mix this on anything. So I'm really initially just kind of mixing these together. And then as it starts to incorporate, I'm going to push a little bit harder to kind of get everything mixed up good there. You've got lots of working time with this. This will set up on its own eventually in about 5 to 10 minutes, depending on the temperature. It's going to set up a little bit faster when it's warmer. You can also set this up a little bit quicker by hitting it with like a light, and I'll show you how to do that. So I'm starting to push a little bit harder now as this gets a little more viscous. And if it's setting up too much for you, you can always add a little more liquid to make it runny again. So now it's pretty well mixed. You shouldn't see any more powder in there. And I'm going to kind of gather everything up on the end here. So you can kind of see that's fairly stiff there. So I'm going to come over to the patient, and you can either use the spatula, a wet finger, if that's all you got, and kind of place that. So I'm going to place that into the hole there. Now there's a lot of excess there, so I'm going to push that down. And then again, either with a wet finger, you can use the patient's saliva or some water, or a wet cotton tip applicator. I'm going to tamp that down and then wipe off the excess. Because again, this stuff is going to set up to be pretty hard once it's set. You're not going to be able to adjust it without a drill. So if the cotton tip applicators are wet, it won't stick to them. So I'm going to get that all pushed down in there pretty good. You can have the patient bite into it a couple times and kind of squeeze down. That'll help push it down a bit too. Once it's set, you can go in there with your carver and trim it back a little bit. So this is getting pretty set here. The other thing you can do, like I said, you can take like a little flashlight. I've got a headlamp here, but if you have like a mag light or a Surefire light, you can just put that on there. And if you hold that on there for 30 seconds or so, that's going to help set that up a little bit quicker. So that's starting to, it's still not firmed up yet, but I can start scraping some of that back with the carver. Now once you think you got it level so that the top of the hole is all as high as the filling goes, you can take your articulating paper if you've got some and have the patient bite into that a couple times. And then have them kind of rub their teeth around side to side and then front to back. And then take a look at that. And there shouldn't be, we've got red marks here. There shouldn't be any red marks where the filling material is at. So if that's the case, we should be good there. It should be comfortable for the patient. Ask them too, does that feel high? Does it feel like you have like a blueberry seed or anything in there? And then once that's done, like I said, if you don't hit it with a light, 5 to 10 minutes, depending on, the air temperature and how you mixed it, that'll be done. So that's how we use Fuji IX. Today I'm going to be going over the USplint material. It's a thermoplastic material you can use to splint teeth for a temporary amount of time. The nice thing about this is it's not permanent. It can come in and out of the patient's mouth. So here I've got the splint that I've already made. So this is for a patient who's knocked a tooth out or knocked a tooth loose. You can place the tooth back in, place this material, and stabilize them until you can get them to a dentist. So ideally, you would use this if you weren't able to get them evacuated back to a dentist in about 6 hours' time. So if you're somewhere pretty remote and you got to wait. So this is the USplint kit. You can buy USplint on makeitmarket.com. Inside the package, you're going to have the instruction sheet, which is this. You're going to get usually it's going to be in this square type material, but they also have some other preformed sizes like this oval, and I'll be using the oval today. There's also an MRE heater if you're not somewhere where you can heat the water up. So you don't need that as well. The manufacturer just recommends a coffee mug with some water in it. You microwave it for a minute and a half and place the USplint material in there, and it'll get soft and pliable. So I'm going to go heat some water up, and we'll show you how to make the splint here. Okay, so we have our patient here. This particular patient has knocked this tooth loose. If it's out completely, it's only going to go back in one way, and we'll talk about that in future videos. But you're going to numb the patient up, make sure they're good and comfortable, because when you push this back in, it's going to be pretty uncomfortable for them. So we're going to get the tooth back into place. We're going to try to line these edges up down here as best we can. Now, not everyone has a perfect bite, so that's just a rough guideline. So we're going to get that back in there. So we're going to put him to the side for right now. You're going to want to have your fingers kind of wet, especially when this stuff is initially heated up. So you can kind of see it's gotten clear here. And be very careful. So even after a minute of microwaving, this is fairly hot. So peel that up there. So I'm going to just roll this into a hot dog type shape here. And my fingers are going to be wet. And let me get the patient's teeth kind of wet here. So we're going to want to splint. If this was the tooth, we're going to want to go to a couple teeth on each side here. So I'm just going to place that like so. And I'm only going to roll it halfway over the teeth. So just like that. Now again, don't worry about messing this up. If you mess it up, you can just take it out and heat it up again and you get a redo. So I'm going to flip this over. You're not going to be able to see this as well in the patient's mouth, but I'm making sure I cover the back of the teeth pretty well too. And just kind of get my fingers wet and again smoothing that out. So you can kind of see how it's wrapped all the way around the tooth on the back to keep it stable. But on the front, I'm only going about halfway. Okay. Now you can have the patient close down a little bit and just stabilize that. And so that's just going to sit like that until it gets set. Now you can see it's kind of a little bit more clear now that we've heated it up. Once it cools down, it'll be that dark blue color, and you'll be able to take it in and out at that point. So again, you let this set up. Be very careful when you're putting the patient's mouth again, because it is pretty hot, and you're going to want to have gloves when you handle that, just due to the heat. So make sure you can handle it in your hands before you place it in the patient's mouth. And then again, you're going to let that set up. And then once it's set, you'll have the patient wear that during the day. They can take it out at night, and that'll again help stabilize these things until you can get them to a dentist and they can have a permanent split put on.